we are continuing on in your anatomy book. I'm on page 357. This is where we left off from video number 1. And we're going to start with the red blood cell disorder. So what can go wrong with our red blood cells? So the first condition is polycythemia. In med term, poly means many. So this is many cells, in this case, red blood cells. And what happens here is that the patient has usually up to like 10 million in their sample of blood. If you remember, it's supposed to be 4.2 to 6.2. 10 million is really high. What happens is that if you have really high count of red blood cells, it thickens the blood. Think of your blood consistency, which is like, it's not water, it's thicker than water. But now think of it as being like ketchup, where it's really thick, okay? So now imagine it trying to go through your veins with that thickness. That thickness is called viscosity, V-I-S-C-O-S-I-T-Y. That viscosity means that your blood's not flowing freely like it's supposed to be. It's very thick, okay? Obviously, we're going to have some problems getting the oxygen out to the body when you have that much. Okay. The next one is anemia. And anemia is simply a generic term meaning low red blood cells. Okay. There are lots of kinds of anemia depending on the cause of why you have not enough red blood cells. Okay. So let's talk about them. We have hemorrhagic aplastic deficiency. Hemolytic. Where's my hemolytic? Might be on the next page. Okay. So hemorrhagic, if you think of the word hemorrhage, means that you don't have enough red blood cells because you are bleeding it out. If I'm in a trauma and I am losing a lot of blood, obviously I'm losing red blood cells. That's a hemorrhagic anemia. I need a blood transfusion like now. And then you need to stop my blood loss, get me to an ER. Okay. You could also have a hemorrhagic anemia from a chronic slow bleed that you may not even know you have. Like you might have a bleeding ulcer and you may not even realize it's bleeding. Okay. And that bleeding ulcer is causing you to lose red blood cells. Okay. The next one is your aplastic. Aplastic is from destruction of bone marrow. Typically, you've been exposed to either chemicals or radiation. By radiation, I mean cancer patients or some other kind of radioactive exposure, like maybe think of Chernobyl, being a nuclear reactor meltdown where radiation leaked into the environment. Okay, that kind of radiation. And so that can be very serious, and it can be fatal if it's severe enough. Typically, with your cancer patients, it's going to be on the minor end of it because it's very controlled exposure to radiation. But we may still need to treat the fact that their red blood cells are dying. Most commonly are the deficiency anemias, which are due to our diet. Okay. Pernicious anemia is a lack of B12. Okay. So either you aren't eating enough B12 in your diet, or it's possible that you're eating enough but your stomach isn't absorbing it. So that even though you're eating it, your body isn't getting it. Okay? So you want to make sure you're getting enough B12 in your diet. The next one is folate. Folate is another thing you get in your diet. Folic acid is also known as B9, another vitamin that is important to get in your diet. And then the last one is iron deficiency, which is probably the most common kind of anemia, is that you are iron deficient. So again, diet, a lot of people take iron supplements because they just can't get their iron up enough. Iron is found in a lot of your a lot of meat. So a lot of vegetarians and things like that might have to take dietary supplements if they're not getting replacement iron from another source. So then just to kind of round out that conversation, I went ahead and Googled what foods are high in B9. So what are we talking about here? B9, legumes, which are beans, asparagus, eggs, leafy greens, beets, citrus fruits, Brussels sprouts, and broccoli. That's just kind of the quick nutshell. B12, clams, liver, fortified cereal. Let's see what else. That doesn't seem like enough. Oh, there we go. Trout, salmon, tuna, beef, Greek yogurt, ham, eggs, chicken breast. So if you're eating enough of these, you're probably getting what you need, okay? But you can see that if you're a vegetarian, some of these come off the list. If you're a vegan, even more of this comes off the list. So if you're going to live some of those alternate diet lifestyles, you need to do a lot of research to figure out what is it you do need to be eating to replace these things so that you get that diet that your body needs. There's other ways to get things. You just have to make sure you're getting it. Okay, then your hemolytic anemias. Okay, there's two main ones, sickle cell and thalassemia. We're going to talk about them one at a time. But what a hemolytic anemia is that your red blood cells are not living long enough. There is a decreased lifespan, which means that 80 to 120 days, that is normal, they're not living that long. Your body can't make that much, can't increase its production that much. So if they're breaking down way too soon, you're going to have low red blood cells just because your body can't replace them as fast. Okay? They also, the abnormal hemoglobin can cause those red blood cells to be damaged. So even though they may still be circulating in your body, they can't necessarily do the job. Okay. So back when we started the red blood cell conversation, we talked about what it looks like, and I likened it to junior mint. Okay. Well, with sickle cell anemia, it is very sharply defined on the one side, and you can see this looks nothing like a regular red blood cell. And that's where it gets its name, from its sickle shape. And it causes the red blood cell to be fragile and not carry the oxygen properly. This is genetic. Okay. It is genetic for someone who carries that sickle cell trait. It is most common, where's it at? Most common in African Americans, there we go. And about 1 in every 600 African American newborns have this. Okay. I had a student once whose daughter had this. I learned a lot about it while she was in my classroom. The next type of hemolytic is called thalassemia. Thalassemia is also genetic. It affects people of Mediterranean descent. So now we're talking Italy, Sicily, Greece, even France, Spain, everything that's around the Mediterranean Sea. That's what we're talking about here. These ones, again, have oddly shaped red blood cells that are also short-lived. Okay? There's mild, there's severe, so there's different levels of conditions that the patient would have. All right, I'm going to stop the video here. We'll do video number 3, starting with the white blood cells.